Hello and welcome to our facility. It's nice to meet you as well. Today you have requested a hearing screening, correct? Correct, okay, good. Now before we get into the questions and whatnot, I wanted to tell you, the difference between a screening and an evaluation. A screening is part of an annual checkup for a healthy individual or someone who may suspect a hearing problem or loss, okay? It's nothing to be afraid of. A lot of people get them done. An evaluation is when you come in after a screening and we see something that may be suspect, something that just seems a bit suspicious. And so we come and examine it further. Or it's when someone already knows they have hearing loss or problems with the ear, we do an evaluation. I know with the doctor setting and sitting in an office, tension can get the best of you. So I wanted to ease the nerves a bit. Good. Now throughout this process, if you have any questions whatsoever or concerns, I'm the girl to let know. So let's go on to our questions. Here we are. I'll be typing them into our computer if you don't mind. So let's go under and make yourself a file. Now, anyone can be screened for hearing. It doesn't mean anything's wrong. Again, like I said, but say the older you are, it's more likely to kind of affect you. So we're gonna go over some basic stuff. You probably were screened as an infant, newborn, and your birth date. Let me go ahead and fill that in. Now what year is that, sweetie? So you're relatively young. Okay, that's great. So we'll go over here. Do you ever find yourself inconsistently responding to sound, such as someone may call you over or knock at your door and you just don't hear it, things like that? Okay, that's good. Now, how is your speech? That may be hard to tell. Do you find yourself slurring, or maybe it's unclear? No? Okay. Do you find yourself turning your volume up a lot because you can't hear well? Okay, well that's something that you want to watch. You don't want to listen to your music too loudly. So, now when you are listening to things, do you find yourself straining, even if you can hear? Is it that you're having to really focus in on what you're hearing? Okay, sometimes. Well, I guess it depends on, what you're trying to listen to, yes. Now, is there one ear, perhaps, that you hear better from? Maybe your right ear is your good ear, or your left ear is your good ear? No? Okay, that's good. Yeah, you could probably notice it on the telephone or iPods, whatever that you're using. Now let's see. Do you hear a constant ringing in your ears? Yeah. Okay. Or do you experience any pain, dizziness? Okay. Well, sometimes it's normal. Dizziness will be caused by an imbalance in the cochlea, which is inside your ear. It's good to keep a little bit of a note on that. Now, let's go down a bit. Do you notice any pus or leaking from your ears or pain even with that? No. Have you ever punctured an eardrum? Okay. You don't stick the Q-tips in your ears, do you? Sometimes. Okay. You want to keep that to a minimum. I know it's sometimes you just want to get that itch, but it's not good for you. Now, you may think that you hear things pretty well. Have you had someone remark about how, oh, you can't hear, or making jokes about you just missing out on things? We need to be aware of the people around us. They give us good cues. Let's see. Now, this question may come off odd. Do you have trouble understanding higher pitched voices such as a woman's voice or a child's voice? Okay. Now, hearing isn't just an overall loss. You can lose hearing to certain pitches. And the first ones that go tend to be that high pitch. To go on, we'll go look. Now the types of tests you'll be doing today will be pretty basic. You'll be doing a beep test. It's kind of, the norm. You'll be doing a simple, where she'll look into your ear, and then another one where she'll just talk into each ear, and you'll repeat back things. Again, it should all go very smoothly. She's not intimidating. I'll make sure she's extra kind today, but I'll go on to this portion when I check all bases. Now, is your blood pressure pretty good? Okay. I have your file. I just wanted to make sure. You've never had a hole in your inner ear, or maybe as a child. A lot of children do this. They put objects in, and sometimes that can leave abrasions that could affect you later in life. No viral infections as of late, right? No ear infections. And visual disorders, because your ears and your sight are very connected. All senses are connected. So. And what medicines are you on? Okay. May seem like an odd question, but certain medicines will mess with your ears if they are ototoxic medicines. They can mess with your hearing, so we check for that, and then it can maybe explain if something's off. Yes. So you never had a head injury or injury to your ear, correct? Okay. Some of these may overlap, but it's good to get an idea of what we're going into, so what we can look for. And even if you say no, a lot of times the doctor, she will go in and look just in case. Sometimes we miss things. So now, your audiologist will be Dr. Devitt. I will inform her that you are here now, and you will go see her. I hope I've been pleasant to deal with. I hope that your exam goes well, your screening comes out clear. From talking to you, I think it'll be just fine. Well, I'll lead you to the back. It's nice to come with me. Meet you. My name is Dr. Devitt, and I will be performing your screening test today to check on your hearing, okay? So, thank you for going through with the receptionist first. I'm sure she told you plenty of times. It's nothing to be worried about, okay? Okay, good. Now, I'm going to tell you what to expect throughout this little test, okay? I'm going to examine your ears. I'm going to talk into both ears, and then I will do a series of beeps, and I want you to repeat those back to me, okay? So, very simple procedures, okay? I want to make sure you're comfortable, and whenever you're ready to just let me know. Okay, good to go? To begin, I'm going to take a little flashlight, okay? And what this light is going to do is going to let me look into your ear, okay? To get a better view of what we're dealing with and to look for anything that may be alarming, such as pus or redness, swelling, anything like that. So let's begin with that. So I'm just going to take a look over here, sweetie. I'm not going to intrude too much. Just get a little glimpse of what we're dealing with here. Okay. So I'm not seeing anything alarming. Your ears have healthy looking wax, which it's a fallacy that you want to get rid of all of it. The wax is actually healthy to have, okay? So we'll go on to your next ear, okay? Take a look. Okay. This one looks equally healthy as well. Let me pull back a little bit, but okay. It's just a soft touch. Okay. And I don't see anything odd, but I want to check for symmetry. This is just standard practice. Okay. I'm going to feel around the ear to just check for any lumps or anything. And you're feeling okay. So I didn't see anything. On to my next test. I'm going to play a series of beeps. I want you to tell me how many beeps you hear, okay? And this won't be in particular ears. I'm just going to play it from this device, okay? So I'll tell you when. 1, 2, 3. Okay, now tell me how many beeps did you hear? Very good. It's going to be the same beep, and we do this test multiple times. It's just to make sure everything goes through clear. Okay? So again, I'll tell you when to begin listening. Begin listening in 1, 2, 3. Good. Now tell me how many beeps did you hear? Okay. Very good. Go through it again. Again, this is both ears listening. 1, 2, 3. How many beeps? Great. Now, the sound isn't too loud or hurting, right? Okay, good. We're going to do one more. Just one more for the road. So, 1, 2, 3. Okay. Now tell me how many beeps. Very good. Now for my next test, it's going to be a bit old school. Since we haven't really seen anything alarming, and you're relatively young, we're going to do the simple talking into your ear and you repeating a phrase, words, number back to me, okay? It's quite simple. go from ear to ear, and I will say things, and I just want you to tell me what I said or answer a question. Who knows? So in this ear, I'm going to be doing a series of numbers. 3, 4, 5. What did I do to that ear? And what numbers were there? Very good. Now, on to the next ear. Can't forget. What does the alphabet start with? Now, what question did I ask? You can answer. I'm sure you know. Good. Go on to this ear again. What is your name? And what did I ask? Very good. And the answer? Okay. And I'll keep doing this until I feel like I had a good reading, okay? How many fingers are on one hand? Again, question, answer. Good. Again, I will be repeating a series of numbers. Just repeat them back to me. 5, 7, 1, 2. Now, what did I ask into that ear? Numbers, good. And what numbers were there? Yeah, I try not to keep the sequences too long. This is a hearing test, not memory. I'm going to do one more final exam just to make sure that everything clears out, okay? Examining the ear, taking a good look. Now, I know you went over some of the questions with our receptionist, but you don't experience any leakage from the ear ever? Okay, good. Now, I don't see anything to be alarmed by. I like to do double checks because you never know. Might have missed something the first time around. Now, to keep with your ear health, I recommend keeping the area clean. I don't recommend doing a lot of poking with a Q-tip or anything like that, so I would stay away from that. But you could clean with a washcloth. Also, be careful of listening to your music too loudly. Keep it to a minimum. I know there's some instances where it can't be avoided, such as a concert or something like that, loud movie. But overall, I think you're doing a great job, honestly. Great job. Okay. So I'm free to let you go now. If you have any questions, feel free to ask. And don't feel afraid to call if anything does arise. It's what I'm here for. Okay. Well, thank you for stopping in today. It's good to see you. And I'll see you soon, okay? Bye-bye.